Um, Hi, I'm Aleksa Manila. The birth of what I would officially call my drag and the persona of Aleksa Manila was born out of HIV activism. It was born out of a social event from an organization, a research study called YAMS. It's called the Young Asian Men Study. It was part of a research study out of CDC, Centers for Disease Control and Prevention. It was part of a 13-city nationwide research study that targeted young, gay, and bisexual men ages, I think 15 to 25 at the time. And the different locations nationwide had a particular focus, and Seattle's was Asian American, gay, bisexual young men. That program believed that culturally, that if you were able to self-identify with your cultural pride, your ethnic pride, that can positively influence your health choices, particularly safer sex negotiations. So I was an HIV counselor and tester for about 7 years with public health. I did this at the bathhouse. The bathhouses, actually, all three of them in Seattle, for 7 years. And I remember the first positive test I had. For some reason, they actually knew who I was, like that I did drag, and they said, "Aleksa, can I get a hug?" Of course, the professional in me was like, absolutely not. I have boundaries, ethics to deal with. But in that moment, it felt to me how important that hug would have meant for him. And I hugged him. And I was obviously crying. And yeah, I think about those moments. And I know it's now it's 2019. I know it's no longer a death sentence. But for my kids my drag kids that have become HIV positive, it's not just because I know, not just because that they told me. It was that moment that I spent with them when they shared that with me. Yes, I'm proud that they had the courage to share that, but it's also heartbreaking because I see them crying, and I see how sad they are. And in some ways, even though, yeah, they're not biologically my children, they ask me, Mother, I hope you're not disappointed. Now I talk about, this type of activism. Of course, I can only hope that, they remain as healthy as possible. But I also realize being healthy isn't about being diagnosed or not diagnosed. Being healthy is here. And I think about what my mom would say. And I know that I would probably, and I have told them this, you'll always be my kid. Nothing will ever change that. And I love you for who you are. And therefore, our duty is to remind people that racism exists, sexism exists, transphobia exists, internalized homophobia exists, and HIV shaming and guilting and stigma still exists. And I don't mean being positive or negative, all of those things, because we're all impacted by it. You don't have to be HIV positive. You don't have to have AIDS. You don't have to be an HIV tester, or to be gay to be impacted by it. They're all connected.